Days away from what could be the largest healthcare worker strike ever in Oregon. And for the first time, it would include doctors in the Providence healthcare system. This has the potential to affect thousands of people who need medical care. So we wanted to get answers about where things stand and what to do if this affects you as a patient. A major strike looming. Nearly 5,000 healthcare givers, from nurses to doctors. An unprecedented call to action against Providence Health. It's set to start Friday morning if the contract impasse doesn't end.
It's high stakes, anything could happen, but typically workers with leverage will exercise that leverage, and the pressure is going to keep boiling until somebody gives.
Keith Cunningham-Parmenter is a Lewis and Clark Law School professor specializing in labor issues. He says the fact that doctors are now part of a union and willing to strike to improve working conditions and patient care is a really big change.
You know, they used to be sort of that identity of noble caregiver, and I think more and more doctors are seeing themselves as just another cog in a bloated healthcare system, and these doctors have said enough.
But a strike this size would have a huge impact, at least short term, on people expecting medical care in the Providence system. On Monday, Providence warned the Oregon Health Authority that it will create a significant risk for health care in Oregon because bringing in replacement doctors is hard to do.
Yeah, I mean, it's really going to have an impact on the patients and the patient care.
Carolyn Zook is a Lewis and Clark Health Studies instructor with lots of experience in the healthcare world in Oregon. She says there are things you can do today to prepare for a strike to come.
So thinking about checking your insurance now before there's a true emergency, maybe seeing if there are urgent care facilities nearby them that are covered by their insurance.
Zook says if you have appointments or procedures set with Providence, call in and ask questions. If it's not urgent, you may reset for later, or maybe your insurance will let you go elsewhere. It depends upon your situation. But Zook says one thing we can all do is be informed and try to stay healthy.
Also, our standard public health practices like washing our hands, staying home if we aren't feeling well, if we're able to.
Of course, there is still time to settle before a strike, and this law professor, who's seen a lot of negotiations, thinks it's more likely that they will.
I think it might reach the 11th hour, but there's just too much at stake, both for the doctors and for the hospitals. Yeah.
So no new updates from the union today. This afternoon, Providence said there is, quote, lots of work going on, and that 2 Providence Women's Clinic bargaining units will be negotiating tomorrow. That includes some physicians and nurses, but no guarantees. So again, best to prepare. We have more information and links to some sites that will help you take charge of your health care. That's at kgw.com.